Hello, my name is Ariana Garcia, and I'm going to be talking about using applied behavior analysis with autism and intellectual/developmental disabilities. Before we begin the presentation, I want to discuss the learning objectives. After watching the presentation, the audience should be able to 1. Discuss the different types of intellectual disabilities, 2. Discuss how 3 ethical codes can be fulfilled in this subspecialty, and 3. Discuss how 5 BACB task list objectives can relate to the subspecialty. Let's first discuss what is an intellectual disability. According to the American Psychiatric Association, it is defined as problems with general mental abilities that affect functioning in 2 areas: intellectual functioning such as learning, problem solving, and judgment, and adaptive functioning such as activities of daily life, communication, and independent living. Within adaptive functioning, there are 3 domains: conceptual, social, and practical. The conceptual domain includes skills in language, reading, writing, math, reasoning, knowledge, and memory. The social domain refers to empathy, social judgment, interpersonal communication skills, and the ability to make and retain friendships. The practical domain centers on self-management in areas such as personal care, job responsibilities, money management, recreation, and organizing school and work tasks. There are also different types of intellectual disabilities ranging from mild, moderate, severe, and profound. While intellectual disability does not have a specific age requirement, an individual's symptoms must begin during the developmental period and are diagnosed based on the severity of deficits in adaptive functioning. This disorder is considered chronic and often co-occurs with other mental conditions like depression, epilepsy, ADHD, and autism spectrum disorder, which I'll discuss further on the next slide. Before I go into detail talking about autism spectrum disorder, I wanted to highlight some of the other types of intellectual disabilities. The first one is Fragile X syndrome, which is a genetic condition that causes a range of developmental problems, including learning disabilities and cognitive impairment. Cornelia de Lange syndrome is a developmental disorder that affects many parts of the body. Prader-Willi syndrome is a complex genetic condition that affects many parts of the body, including developing an insatiable appetite, which leads to chronic overeating and obesity. Down syndrome is a chromosomal condition that is associated with intellectual disability, a characteristic facial appearance, and weak muscle tone. Angelman syndrome is a complex genetic disorder that primarily affects the nervous system. And then autism spectrum disorder, which is a complex developmental condition that involves persistent challenges in social interactions, speech, nonverbal communication, restricted and repetitive behaviors. And as we know, the effects of autism and the severity of symptoms are different in each person, which I will discuss in more detail on the next slide. Now I will go into more detail discussing autism spectrum disorder. Individuals tend to have communication deficits, such as responding inappropriately in conversations, misreading nonverbal interactions, or having difficulty building friendships appropriate to their age. In addition, they may be overly dependent on routines, highly sensitive to changes in their environment, or intensely focused on inappropriate items. Characteristics of ASD fall into 2 categories: social interaction and communication problems, restrictive and repetitive patterns of behavior, interest, or activities. For social interaction and communication problems include difficulty in normal back and forth conversation, reduced sharing of interest or emotions, challenges in understanding or responding to social cues such as eye contact and facial expressions, deficits in developing, maintaining, understanding relationships, such as trouble making friends, etc. For restricted and repetitive patterns of behavior, interest, or activities include hand flapping and toe walking, playing with toys in an uncommon way, such as lining up cars or flipping objects, speaking in a unique way, such as using odd patterns or pitches in speaking or scripting from favorite TV shows, movies, etc., having a significant need for a predictable routine or structure, exhibiting intense interest in activities that are uncommon for a similarly aged child, experiencing the sensory aspects of the world in an unusual or extreme way, such as indifference to pain or temperature, excessive smelling or touching of objects, fascination with lights and movement, and being overwhelmed with loud noises, etc. Again, the symptoms of people with autism fall on a continuum, with some individuals showing mild symptoms and others having much more severe symptoms. The three sub-area topics that I'm going to discuss are intensive comprehensive intervention for young children, focused intervention, and treatment of severe problem behaviors. The goal of, according to Howard 2019 in her presentation, the primary goal of comprehensive intensive early intervention is to prevent intellectual disabilities and improve language, self-help, and social functioning. She also discussed in her video focused interventions, and one of the focused interventions I'm going to highlight is for feeding disorders. And Piaz 2008 discussed that treatments based on the principles of applied behavior analysis have been highly effective in increasing the variety of foods consumed and decreasing inappropriate mealtime behavior in individuals with food selectivity. In the last research for treatment of severe problem behaviors, I'm going to talk about functional analysis, which was developed by Iwata and colleagues 1982-1997, which said that functional analysis methodologies have been applied to the assessment of many topographies of problem behavior in individuals with developmental disabilities to identify the environmental variables maintaining the problem behavior. Let's talk about how ABA can help. Cooper, Heron, and Heward 2007 define ABA as the following. Applied behavior analysis is the science in which tactics derived from the principles of behavior are applied systematically to improve socially significant behavior, and experimentation is used to identify the variables responsible for behavior change. Now, I'm going to talk about the 7 dimensions of ABA and how they can be applied to the subspecialty. There's applied, behavioral, analytic, technological, conceptually systematic, affective, and generality. In the applied dimension, interventions target behaviors that will result in socially significant change. Therefore, this can be related to the subspecialty of autism and intellectual disabilities by improving the quality of life for these individuals. For example, targeting behaviors that are going to help them communicate through functional communication training instead of maladaptive behaviors will improve their quality of life. In the behavioral dimension, interventions target measurable behaviors of interest or importance. This can be applied to the subspecialty of autism and intellectual disabilities because the behaviors we target for these individuals must be observable and measurable. When we operationally define the behaviors, we are able to collect data and show change over time. In the analytic dimension, interventions allow for demonstration of a functional relation between the independent and dependent variable. This can be related to the subspecialty of autism and intellectual disabilities because we collect data and use this data to make informed decisions on the interventions that we use for the individuals. For the technological dimension, procedures must be described in sufficient detail to allow replication. This can be related to the subspecialty of autism and intellectual disabilities because the procedures written for these individuals must be clearly and concisely described so that any other individual, such as an RBT, a BCBA, parent, etc., can pick up the plan and implement it accurately. In the conceptually systematic dimension, procedures and effects are described based on the principles of behavior analysis. This can be related to the subspecialty of autism and intellectual disabilities because these interventions must be consistent with the principles demonstrated in the literature. It is very important that anyone, such as a BCBA, RBT, parent, etc., use research-based interventions. In the affective dimension, interventions affect behavior to a socially significant degree. This can be related to the subspecialty of autism and intellectual disabilities because the interventions created for these individuals are effective when they improve behavior in a practical manner. These interventions must ask questions like, is this intervention working? Am I seeing the data going in the direction that I want it to? We can determine if an intervention is effective by collecting data and observing how the intervention is being utilized. For the generality dimension, interventions plan for behavior's durability over time and occurrence across environments. This can be related to the subspecialty of autism and intellectual disabilities because the behaviors we are targeting, we want to show that they can be transferred to other contexts other than the environment that we are training them in. We want these behaviors to be used across multiple settings, either in the home, clinic, school, across multiple people, with mom and dad, with teachers, with RBTs, with grandma and grandpa, etc. And we want them to be continued to use in the future, even when they are no longer receiving ABA services. Now I'm going to discuss the BACB task list objectives, specifically the 4th edition task list, and how supervisees pursuing their certification as behavior analyst could demonstrate mastery of at least 5 task list objectives during their behavior analytic practice of the subspecialty autism and intellectual disabilities. So first, BO2, they can review and interpret articles from behavior analytic literature. And as I mentioned before, it is really important to create interventions from the literature and that are based on the principles of behavior analysis. Therefore, this requires individuals to review and interpret articles from the literature to stay up to date on new interventions and practices. D01, use positive and negative reinforcement. Reinforcement increases the future likelihood of a behavior occurring. Therefore, it is very important to use both positive and negative reinforcement in interventions. Also, D07, conduct task analysis. So, as we mentioned in the beginning, some of the characteristics of autism, task analysis are really important for these individuals when working with these individuals because they break down skills into smaller, more manageable components. And these task analysis can be used to teach learners with autism or intellectual disability skills that are too challenging for them to teach all at once. So examples of task analysis that could be used are for brushing teeth, bathing, dressing, making a meal, performing a variety of household chores, etc. F07, use functional communication training. I also mentioned this before when discussing maladaptive behaviors, that all behaviors are a form of communication. And a lot of the individuals with autism and intellectual disabilities have deficits in communication. Therefore, they engage in these maladaptive behaviors as a way to communicate. Therefore, we need to use functional communication training to teach them how to appropriately communicate their wants and needs. And lastly, J10, when a behavior is to be decreased, select an acceptable alternative behavior to be established or increased. So this kind of goes in conjunction with the previous task list that I mentioned and also mentioned in the beginning when we are working with individuals with autism and intellectual disabilities. Not only are we reducing maladaptive behaviors, but we also need to focus on increasing socially appropriate behaviors, whether that is communicating that they need a break, that they want attention, or communicating that they need help. Another replacement behavior must be also targeted while we are decreasing those maladaptive behaviors. I want to highlight 3 ethical codes from the Professional and Ethical Compliance Code for Behavior Analysts. The first code is 1.02 Boundaries of Competence. This code states that all behavior analysts provide services, teach, and conduct research only within the boundaries of their competence, defined as being commensurate with their education, training, and supervised experience. Behavior analysts provide services, teach, or conduct research in new areas only after first undertaking appropriate study, training, supervision, and/or consultation from people who are competent in those areas. Therefore, this can be related to the subspecialty of autism and intellectual disabilities because, as we mentioned in the beginning, the field has a lot of different disabilities that behavior analysts can intervene upon. Therefore, just because someone is competent in working with young children in early intensive intervention settings does not mean they should the next day start working with adults in the treatment of severe problem behaviors. If a behavior analyst wants to work with a different population, they must make sure that they receive, like the code states, training, supervision, and study and consultation from people who are competent in that area. The next code that I'm going to discuss is 3.01, which is Behavior Analytic Assessment. This code states that behavior analysts conduct current assessments prior to making recommendations or developing behavior change programs. The type of assessment used is determined by the client's needs and consent, environmental parameters, and other contextual variables. When behavior analysts are developing a behavior reduction program, they must first conduct a functional assessment. Behavior analysts have an obligation to collect and graphically display data using behavior analytic conventions in a manner that allows for decision and recommendations for behavior change program development. Therefore, this can be related to the subspecialty of autism and intellectual disabilities because we need to make sure that before we intervene upon the behaviors of these individuals, we are conducting assessments to determine what is the function of these behaviors. Like I mentioned earlier, if we want to reduce a maladaptive behavior such as aggression and teach a functionally appropriate behavior, we want to know why the individual is engaging in the aggression in the first place. Is it because they are communicating that they want attention, or that they want to escape or avoid a situation or a person? Are they communicating that they need help or that they want something? Therefore, we need to conduct assessments to determine what appropriate behaviors we're going to increase while also reducing that maladaptive behavior. And then the last one is 4.03, Individualized Behavior Change Programs. And this code states that behavior analysts must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of each client. Behavior analysts do not plagiarize other professionals' behavior change programs. Again, we mentioned this in the beginning of the presentation that even though the subspecialty of autism and intellectual disabilities may look similar, not two individuals with these disabilities can present similar symptoms. Therefore, just because something worked with one individual with the disability does not mean it's going to work with the other individual with that disability. Therefore, each program and intervention must be individualized for that person. How can you pursue further education and training in autism and intellectual disabilities? You can subscribe to behavior analytic journals such as the Journal of Early and Intensive Behavioral Intervention or the American Journal on Intellectual and Developmental Disabilities. You can listen to podcasts such as the Autism Helper or Why We Do What We Do. Or you can continue reading in the literature such as books. And one of the books I'm going to highlight is Ethics for Behavior Analysts. And then also you can attend conferences and presentations to keep up with your credential and maintain and obtain CEUs.